Let's dig into this material and take a closer look at what conditions you need to meet for each level. Which code would you like to learn about first? For a low complexity evaluation, there are no personal factors or comorbidities that impact the plan of care. The examination will use standardized tests and measures, patient assessment instrument, and/or other measurable assessment of functional outcome that addresses 1 to 2 elements from any of the following: body structures and functions, activity limitations and/or participation restrictions. The patient's presentation will be stable or with uncomplicated characteristics. These factors will result in a low complexity evaluation. To rise to the level of moderate complexity, the patient history must show 1 to 2 personal factors or comorbidities that will impact the plan of care. They must impact the plan of care or they do not count. An examination of body systems using standardized tests and measures, patient assessment instrument and/or measurable assessment of functional outcome addressing a total of 3 or more elements from any of the following: body structures and functions, activity limitations, and/or participation restrictions. The clinical presentation will be evolving with changing characteristics. This type of evaluation will require clinical decision-making of moderate complexity. If any of these requirements are not met, then the evaluation will default to the lower level of complexity. To be considered a high-complexity evaluation, a patient history of their present problems will need to have 3 or more personal factors and/or comorbidities that impact the plan of care. The examination will need to address 4 or more elements from the following: body structures and functions, activity limitations, or participation restrictions. The patient presentation will be unstable with unpredictable characteristics. This evaluation will require clinical decision-making of high complexity. And keep in mind that if any of these conditions are not met, then this evaluation will default to a lower level of complexity, either moderate or low complexity. If there are lots of comorbidities or personal factors, but the patient presents as stable and has uncomplicated characteristics, while not what we would expect, this would be a low complexity evaluation. Physical therapy is also getting a new reevaluation code, but it is the same as the reevaluation code you use now. There's only one level, one code for all reevaluations, and a reevaluation can only occur after there's an established plan of care in place. Here is a review of the other elements of the reevaluation.